This patient will be going for the deep plane facelift, the upper SMAS and the lower neck SMAS. So the cheek deep plane SMAS facelift will address mainly this area. The nasolabial line, the marionette line, and the anterior part of the face. We are going to divide the ligament of the zygomatic ligament, the cheek ligament, and the mandibular ligament going under the SMAS, dividing all the ligament going anterior and then lifting all the muscle. Again, we'll be going about 2 centimeters below the mandibular margin and doing the deep SMAS neck lift in order to address the submental area and achieve more defined, cervico-mental angle, as you will see the end result on the table after we finish doing the lower neck deep SMAS. So the patient is going to have deep brain SMAS facelift, upper cheek, and also the lower neck deep SMAS lift. So I hope you enjoy the procedure. This is the most advanced technique, which is dividing the ligament of the face. This is the Mendelson technique. You will be seeing Mendelson from Sydney. Exactly the same technique. I hope you enjoy the procedure. Bashar Bizra for our randoplasty and facial plastic surgery academy in London and Dubai. Thank you. This video aim is to show how to avoid as much as possible the main important 2 branches of the facial nerve during facelift: the frontal branch or temporal branch and the mandibular branch. This is the zygomatic bone, and this is the zygomatic process there. And the frontal branch runs from just below the lobule and just for about 1 to 2 centimeters lateral to the eyebrow. So the frontal branch from this point below the lobule up to the lower border of the zygomatic branch run deep between the 2 lobes of the parotid and under the periosteum. On the junction between the medial to the intermediate, between medial or middle portion of the zygomatic bone, the junction there, it becomes more superficial and emerge from under the periosteum. So it emerges from under the periosteum there and go deep under the deep fascia, deep temporalis fascia. So we have the temporalis muscle there attached to the zygomatic process, the temporalis muscle there, attached to the zygomatic process. So the facial nerve run below the zygomatic arch, below the quite deep below the periosteum and between the 2 lobes of the parotid gland, below the periosteum, emerge at this junction of the middle to the medial from the periosteum. Emerge through the periosteum here, become more superficial, and go under the deep fascia of the temporalis muscle. So therefore, when we do now our undermining of the sections there, we should stay superficial and never go below the temporalis fascia, the deep fascia of the temporalis muscle. Never go below the deep fascia or the temporalis fascia. Only stay under the skin in this area above the zygomatic arch. So that's now how we try to avoid. Always you have to bear in mind, always there is variation. So you have to keep in mind about 1 centimeter medial and 1 centimeter lateral also. So there is nothing fixed. So the branch may go like this slightly, may go like this slightly. So again, summary, it stays deep there between the 2 lobes of the parotid and then emerge from under the periosteum to become under the temporalis fascia in this area, the junction usually between the middle to the medial with some variation, and there it stays under the temporalis fascia. So therefore, you undermining or your dissection to stay quite superficial in this area, never go below the deep temporalis fascia. Now the mandibular branch, this is the angle of the mandible there. This is the angle of the mandible, and this is the margin of the lower margin of the mandible, ramus of the mandible. The mandibular branch hooks like this there, and usually run in this area, usually around this area there. So therefore, in our undermining, when we do the upper SMAS, we stay about 2 centimeters above above the angle of the mandible, 2 centimeters above the angle of the mandible. That's where our deepest mass on, so stops 2 centimeters above the angle of the mandible, and we go this way and into the ligamental area for deep plane facelift. So this is where our deepest mass will go there. So we are 2 centimeters above the margin of the mandible, above the angle of the mandible. So we start from just below the zygomatic, lower edge of the zygomatic body, our incision into the deepest mass, and our incision start from the lower border of the zygomatic body and go all the way through down toward the angle of the mandible, but stop here 2 centimeters above the angle of the mandible. Again, when we do the the lower neck deep plane SMAS, this is the anterior border of the sternomastoid muscle there, anterior border of sternomastoid. Again, we go 2 centimeters below the angle of the mandible, 2 centimeters there, and we elevate our SMAS up to the midline all the way here, along the anterior border of the sternomastoid, and we as we said, 2 centimeters below the angle of the mandible, and we elevate the SMAS there, and then do the lifting of the SMAS there to the mastoid process. So this area now, 2 centimeters above the edge of the mandible, 2 centimeters below, is preserved. No SMAS in this area, and this between my two fingers. No SMAS here between my two fingers. No SMAS elevation. Only subcutaneous, in order to avoid any injury to the mandibular branch of the facial nerves. So you stay 2 centimeters above the lower border of the margin of the mandible, and 2 centimeters below it again. So you save the brain again. So all this area from here to there, no SMAS. The SMAS only in this area there and in this area there. While this area, no SMAS, only subcutaneous. Anyway, the ligament, mandibular ligament here is superficial. It's not a deep ligament, they're superficial there. We are going to divide the deep ligament there in the cheek, on the zygoma, and on the cheek. So I hope this have given full information about how to avoid the injury to the main two branches of the facial nerve during facelift. This is Bashar Bizra from our Rhinoplasty Bizra Academy and the London Academy of Facial Plastic Surgery, and our centers in London 22A Harley Street, and in Dubai Sheikh Zayed Road. Thank you for watching me. Okay, so start our incision now. Always avoid this incision in the Middle Eastern Gulf patient, also an Indian. Anyway, I mean any patient with skin type 4, 5, and 6, because it's leaving really an ugly scar there, and scar you cannot remove it. It's leaving an ugly and pigmented scar. So best to avoid this incision in such patient and do the incision from there. You can do this incision in Caucasian patients, patients with skin type 1, 2, and 3, but not definitely with patients with skin type 4, 5, and 6, which includes all the Middle Eastern, the Arab patient, and the Gulf patient, the Indian patient, the Asian patient, the African patient should be avoided this incision. So we start now our incision, try to be superficial as much as possible. Going around the ear there, and then just behind the tragus there. And a small right angle here, and then now just to about 2 millimeters below the earlobe, in order to avoid any traction on the earlobe, and then just behind the ear all the way up where the ear meets the skull there, and then hooking up and then going down all the skull down there. Okay. Okay, now we start with sharp scissors, start to removing this flap. We try to be very superficial. Again, let's hear what I explained before about the frontal branch of the facial nerve, that once on the zygomatic arch, it merges from the periosteum and stay under the temporalis fascia. So you have to stay under the skin in the area, never try to go deep and under the temporalis fascia to avoid any injury to the nerve.
Sige.
We start to see under the hair follicle, as you see, in order to be on the superficial area. Control with my outside finger there. Superficial. If you want, let me pause. Okay, clean nicely there. Of the tragus again. Stains subcutaneous. The main trick to stay very subcutaneous in order to leave adequate tissue for the SMAS. Clean nicely, follow me, clean. Actually, because there are so many theories about the SMAS, some people now they say there's no SMAS, only subcutaneous tissue. So many there are some theories now, so they say there is no SMAS, only something called subcutaneous tissue. So therefore, that's why you have to preserve as much as possible of this subcutaneous tissue in order to be able to go deep to the and open to the ligaments. Attending recently a nice conference, and one presented a paper to say there is no SMAS. Okay, both, new both. I see the field is almost quite nicely and dry because we nicely prepared with it. Let's go from the back now with the clean here also clean there. With the Thomason technique. You see, I'm going this way. I'm not doing this way. You see the direction of my scissor is parallel to the skin, is not vertical to the skin. In order to stay superficial and just under the hair follicle, over this area, the scalp which was blood. So sometimes you get some bleeders, we'll control it later, it's okay. The main thing that you stay quite superficial to preserve as much as subcutaneous tissue, because the SMAS lies within this subcutaneous tissue. So if you go slightly deeper, you'll not be able to hold the SMAS nicely. Okay, now. So here's now our scissor. Can you blunt scissor now? Blunt scissor.
There's a short handle.
Give me the short one now. It's too early for the long one. I'm not going to go down to the neck. You see my scissor barrel to the skin and my hand pushing there. This way so you can control that you are superficial. Hey, be careful not to go through the deep fascia, deep tumbarous fascia, because the frontal branch runs here, just under the fascia, straight away. So you have to be careful in this area that we stay very, very superficial along the course of the frontal branch of the facial nerve. Continue my undermining now. They're going to be my SMAS incision. So I'm not going to go too much beyond the SMAS incision. Here goes the ligametic body there. You know, this is my SMAS, deep SMAS line to go. I'm not going to go too much below the SMAS line. That's anything. 2 centimeters only.
May mandalo. Ano na ba siya? Hindi, meron na lang.
You know the loop system? Not now, later. Let's make it ready. Yeah, I'm going deep because I want to go for my
Mandalo ang scissor.
neck. Yes. Push into the long one now.
Yeah.
Ito maalis
So
yun.
he can record.
Because my fingers are outside, you know, to stay superficial. So I think we got a good space now. هذا أي واحد mandibular ولا إيش؟ mandibular. You see, I was quite below the mandibular margins. The start to beep. Very nice, my hand there, very nice exposure as you see. Also there, give me those. And we are doing the facial nerve monitoring as you see there, the facial nerve monitoring. So we have the electrode connected to the face and the connected machine towards the facial nerve. I get towards the nerve, I get straight away a bead.
Nakutan tayo ito naman. Ay, hindi pa. Baka kainin natin. Try natin.
Okay, so this is the incision of my now deepest SMAS. Starting, this is the angle of the mandible 2 centimeters above the angle of the mandible going towards the zygomatic body there. Okay, so we start now opening into the SMAS. Start opening into the SMAS now. That's it, I just open to SMAS now, as you see. And then going down. You see 2 centimeters above my margin. Again, give me fully curved now. Again, up to the body of the zygoma there. From the smile there. Okay.
Ready.
The body of the zygoma. Okay. This is the margin of the mandible, just down there, and I see 2 centimeters above, and okay, I'll go up slightly. This is a line now for the inferior space, and from the nose near up to here, the line for them. So this is the inferior space, this is the middle space, and below there we have now the zygomatic space. Okay. So give me now the. Okay. So we start now onto the inferior mid mesenteric space, as you see, and with my under the SMAS now, with my finger, right, to go all the way down until I reach just to the near the magnet line. So I push my finger up to here. You see where I am now? Exactly near the magnet line, as you see from outside. Okay. So now I will go into the middle space. Let me not too slow, sir. To see the middle space now. The ligament there. The bottom gland, bottom capsule very clear here, you can see it very clearly. Again, so the space. I don't want to remove the buccal fat because usually in this old people they have fat atrophy, so why we go and remove more fat? You should really reserve the fat, not remove more fat. It's my theory. So you see now with my finger now there. So this is the middle space, and this is lower buccal branch, upper buccal branch. And now I think this is the parotid duct. You can see the parotid duct very clearly here. You see the parotid duct extremely nice and clear. The parotid duct very clear there. Now we go with my scissor towards the cancer here. I want to open into the zygomatic space. I'm sure my scissor on the body of zygoma now, and see the duct is quite clear there. On the zygomatic body now, my scissor. going towards the lateral canthus. Okay. And now we give me the probe. We check, make sure before we divide any of these ligaments. No, nothing. Nothing there. Okay, give me the scissor now. Just divide segment at the roof of the SMAS. No, give me again the. So it's very nice, clear, good anatomy here. Okay. Middle ligament here. You can see the buccal fat nicely there, but I don't want to remove it. And then we go there to this ligament there. Give me the rope now. Again. Let's see. You see the duct there. Yeah, because it's coming with the duct here. Yeah, the facial nerve monitoring there start to beat because I'm here close on the zygomatic brush of the facial nerve. You see, yeah, start beating there. So with this cotton bud now, just going there, gently onto the zygomatic space. And the axis, you know, I'm now, you see there, I'm on the zygoma, there's the body of the zygoma there, as you see from inside, outside. Okay. Pushing all this ligament down, dividing releasing all this ligament. And this is the duct, very nice there. Developed duct, very nice. It should be really almost enough. More peanuts. Me mosquito. I'll just show you the buccal fat there. There's a buccal fat, but I'm not going to remove. I see buccal fat. I'm not going to remove. I'm going to leave. Okay. So we start now our suture now. So we've got nice line here. Now you see, where's my hand? My hand almost as a nasolabial fold, as you see. My finger as a nasal. That's what I want to achieve my goals when I reach this nasolabial fold. It's under the SMAS. I'm under the SMAS on the nasolabial fold. Okay. So we start with the lower one first. Okay. Going through the flap here. You see now, you just go up. You stay as you are. And you just wanted to show you how. Give me a new one. Go up, so you see how much muscle lift we are obtaining and outside. You see now, upper neck and jawline. Okay. Second one. You will put 3 to 4 suture. And again. Make sure that you don't carry the carotid duct with you here. Yeah, so yeah, don't carry the carotid duct on. Addressing the lower portion of the nasolabial fold and marionette line.
Huwag mo lang. Padumi na siya.
One more. You are straight under the muscle, not going deep because all the nerves are below you now. Wait a minute.
BDS.
This one is not strong. You need one more here. Give me one extra. I see
Adiban din.
one again here. Nice release here. Okay, give me one more.
Meron na.
Short. Now we remove all this excess of this mass which you see now under my finger. Okay, too small, okay. So this is really deepest mass with releasing of all the ligament of the retaining ligament. Okay, now we let me now with this. Hold up.
Ngipin mo hawak na. I-change ko.
Okay.
Nantot mo siya. Okay. Hindi mo tutulog siya.
Give you more lift and more support. The way I should show it.
Bago mag-drain.
The angle of the mandible is there. The last now. Okay, cut. So see now, before we start doing the lower neck, how much lift we already obtained and doing this technique. Okay, we'll go to the lower neck now. Is the margin of the mandible now there? There's the margin of the mandible. Okay.
Dito ko sa lower.
So, and then I will go about marking about 2 centimeters below, and will open my SMAS here. So as you see, this is the margin of the mandible and 2 centimeters below to preserve the mandible branch. I go down this area and to under the SMAS, very nice plane. As you see, I will just now try to go forward. You see the SMAS, very nice SMAS plane, and all the way as much as possible towards the midline of the neck on this nice plane. It's a nice cleavage because I'm on the right plane. All the way forward as much as possible. You don't have to reach to the midline, but as much as possible. Maybe this not used to it. So it's nice to use now. And this area. Beautiful. All the way, so very nice SMAS. This is called the lower SMAS. Not many surgeons who does this, but this is very, very excellent for the cervical mental angle to achieve a 90-degree angle there. Go up as much as you can. So you've got very nice pocket all the way down here. Very nice, and give me for it. Let's try to enlarge this way slightly. So now I push on my finger all the way through.
Change your perception.
Okay, so that's very nice. You see now, you can see the bucket which I made.
Yes.
Yeah, okay, give me
Okay,
this.
papalit ako hawak mo.
All the way through, along the anterior border, the border of the sternomastoid.
Change perception.
Change what?
Perception, teacher.
Oh, okay, I see. So I got nice flap. Let us have the first other side. Can you see the here? Okay. And now, when we hold the flap, you can give me the scissors, right? Let's see. Let's hold the flap down here. I call it the sheath there, you see, very dangerous now here. I will just divide now the inferior border of the flap. You can see the curvature sheath now. Okay, give me switch hand now. I got this flap now, nice flap to address the submental area and the lower neck and hold the ear up for me. I'll see where the mastoid process just there and go through the now the mastoid process, and then with my finger go to this flap now there. And you see now the effect on the lower neck. The Bechan got very short neck, we can't extend much, but we can see now the effect there on the lower neck. Okay, so again, another session. See now how much we achieve in left. Very nice, extremely nice. Look at this now, at this now angle there, extremely nice angle. And you see from inside how much lift we obtained now there. I'll try to remove some of this fats now later. Yeah, hold it, extremely nice. This is a very nice maneuver to correct the double chin, the lower SMAS, lower neck SMAS. Okay. So one more now. Okay, this is my finger in the bucket, you see. Okay, one more. One more there. Okay. Can see the anterior jugular veins there and the carotid sheath. It's not a joke at all. Okay, clean my sleeve there. Okay, leave it for 1 second. No, leave it for
Relax.
relax yourself. Okay.
Wait lang natin. Oo. Okay lang.
Okay.
Sir, gusto ko na sir. Hindi. Na-pigtas na sa loob.
Nabasya ang carotid sheath. Yes, like this. Sushi. Antibiotic wash, as you see. Section there. Again, antibiotic wash. And with this hair. Make sure there's no hair there left.
Two down boss.
Using the drain now. Okay. This is all now. Hold. Okay. Okay. Stay there.
Stapler sir. Hold mo na lang Mark yung stapler. Okay, natapos siya po yung standby mo sir. Para man-sir.
Okay. Give me scissors. Okay, twist for a sec. Good enough.
Malaki. Nasod. Kasi ano magpupupi niya. Change yung tooth force sir. Magpupupi niya. You see sir?
Okay, give me still lang now. Move this still there for me. Move the head, move the head. Move this to 17. We will adjust it later. We're just doing now only key sushi. Will be all be adjusted now later. We'll show you the result.
Nasusok pa ako.
Okay. So this one.
Kinalabit niya. Parang kung kinagat. Pero hindi. Kanina pa to.
Moses still from this one. This one.
Kasi tumalsik sa mukha. Kasi kasi pag tanggal ko, tumalsik sa mukha.
Okay, give me scissor. Okay, still nice. Okay. Adjusted. Now this is very critical here. Okay, give me the.
Flicker.
Yes.
Naka-ready na yung picture mo na kono.
Just a sec.
Ay, may
Okay, give me now.
mono ko rin. Ano natin?
Okay. Suture, key suture again now on the.
Mono ko rin.
No, key suture.
Mono ko rin.
Maybe. Okay.
So, papalit ako sa patas.
Okay, move this one for me.
Ano sa hair niya. Tik na.
Okay, give me.
Gusto mo ba ano? You want this?
Save that here.
Ah.
Okay.
Scissor.
Yeah.
Sharp this one. Hindi tapos na siya sa... Hindi ko lang tawag dun sa... inside
Okay. Give me stable now. Okay. Oh, that's okay. So we did now just add the primary closure now with the final closure at the end. And let's just give me one suture now, key suture here. Very nice closure, but it will be now my colleague. Okay, give me sharp scissors. Okay. Remove this fat from there. Now initial key suture, it will be repeated all again now, but yes. It's difficult because she has got a lot of skin to be removed, because she has really excellent SMAS, as you have seen. When you get this such good SMAS, when you get a lot of skin, the thing that's like, there's some more skin here, give me. Okay, give me a switch. I'll do this one. Put back again, new one, make it new one.
Give me
Because
new
if we
one.
get blood, she will get blocked ear from you.
Gawa ka niyang niya. Dito lang ba kulit?
Ano natin? Pang-ilaman.
Only key sutures. We'll be doing a perfect closure at the end once we finish the other side. Okay. So now we will just